CPR. Few facts. Cardiopulmonary resuscitation or CPR is a life-saving technique useful in many emergencies, leads to improved survival and neurological outcomes. Resuscitation includes all measures that are applied to revive patients who have stopped breathing suddenly and unexpectedly due to either respiratory or cardiac failure. Cardiac arrest is one of the most common cause of cardiorespiratory failure. The respiratory and cardiovascular systems are interdependent. The heart consumes most oxygen than any other organ in the body because it is constantly beating. When the lungs stop working, the heart fail occurs. Conversely, the ventilation of lungs fail soon after the heart stops. What does CPR stand for? C stands for cardio, that is heart. P stands for pulmonary, that is lungs. R stands for resuscitation, means to recover or recovery. Definition. Cardiopulmonary resuscitation consists of the use of chest compressions and artificial ventilation to maintain circulatory flow and oxygenation during the cardiac arrest. Cardiopulmonary resuscitation is technique of basic life support for oxygenating the brain and heart until appropriate definitive medical treatment can restore normal heart and ventilator action. Purposes: to maintain an open and clear airway, to maintain breathing by external ventilation, to maintain blood circulation by external cardiac massage, to save life of patient, to provide basic life support till medical and advanced life support arrives. Indications: unconsciousness, pulseless, no breathing, no circulation, obstructed airway. Dead cases where no pulse and no breathing can be detected. Drug overdose, drowning. poisoning, non-fatal cardiac arrhythmias, shocks and seizures. Cardiac arrest. Causes of cardiac arrest: anoxia caused by airway obstruction, myocardial infarction, anesthetic depression, hypotension, retention of carbon dioxide, drowning and other forms of asphyxia, choking, resulting in an inadequate ventilation of the lungs. Electric shock, carbon monoxide and other types of poisoning, drug reaction, pulmonary embolism, extensive hemorrhages, brain injuries, hypothermia, electrolyte disorders and drug therapy. Contraindications: do not resuscitate instructions, severe cardiogenic shock, uncontrolled bleeding or coagulopathy, bone trauma or chest trauma, CABG or any other open heart surgeries. Equipment: CPR can be performed without specialized equipments. Universal precautions should be taken: cardiac defibrillator, ambu bag and mask. CPR guidelines by American Heart Association 2015. Technique: A, B, C has been changed to C, A, B. C stands for compressions, A for airway and B stands for breathing. D stands for danger, R response, S send someone for help, A airway, B breathing, C circulation / compressions, D defibrillation. Before you begin, check if the scene safe, if the person conscious or unconscious. If the person appears conscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" Wait for 10 seconds. Check carotid pulse. Call 102 or local emergency number. Positioning for CPR. The patient lay supine on a relatively hard surface. The person giving compressions should be positioned high enough above the patient. Put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Site of giving compressions. Place the heel of one hand over the center of person's chest between the nipples. Place your other hand on the top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, as you push straight down on the chest at least 2 inches, approximately 5 to 6 centimeters. Push hard at a rate of about 100 to 120 compressions a minute. Allow the chest to recoil, but do not lift the hands off chest. Chest compression rate 100 to 120. Chest compression depth 5 to 6 centimeter. Infant compressions. Use your 2 fingers, 1/3 to half the depth of chest with each compression. In spite of 2 fingers, thumbs can also be used. Airway. Clear the victim's airway. Open the airway using head tilt chin lift maneuver. head tilt, chin lift, done by putting palm on the person's forehead and gently tilting the head back. Check for normal breathing, taking no more than 5 to 10 seconds. Breathing. Breathe for the person with the airway open using the head tilt, chin lift maneuver. Pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Prepare to give 2 rescue breaths. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. Seal can be formed over the mouth by using ambu bag and mask if available. Observe for chest rise and follow cycle of 30 compressions and 2 breaths. Resume chest compressions. Five cycles of CPR, AED First shock, 5 cycles of CPR AED second shock. If no AED available, continue CPR. When to stop cardiopulmonary resuscitation? Return of spontaneous circulation, return of spontaneous breathing, arrival of arrest team, if the rescuer becomes exhausted, when death is confirmed, complications of cardiopulmonary resuscitation. Victim may sustain injuries, broken bones, vomiting and aspiration, body fluid exposure, gastric distension, do's and don'ts. Go through the table for what rescuer should do and what rescuer should not. Frequently asked questions. When performing one-man adult CPR, how long should one check to the breathing of the patient? At least 5 seconds and no longer than 10 seconds. Why is recoil important during compressions? It allows complete refilling of the heart. Incomplete recoil will reduce the blood flow created by the chest compressions. In an adult, how many compressions should one deliver in 1 minute? 100 to 120. How long should one take to deliver a regular breath? 1 second to deliver each breath. You must deliver enough air to make the victim's chest rise. How far should you press down on a child age 1 to puberty? 1/3 to half the depth of chest with each compression. Where should you check the pulse, on a child or on an adult? Carotid artery. Thanks.